What is your job and what does a typical day look like for you?
I'm a physical therapist. I typically work 8 to 5, 4 days a week. I see usually around 10 to 11 patients a day. I see them typically 40 minutes each, one on one, and I have about 40 minutes total of time, documentation time, which is paperwork time, scattered throughout the day as well.
Okay. What kind of education or training is required for your job?
When I went to school, it was a master's degree in physical therapy. Now it's a clinical doctorate degree, which means that you need 4 years of an undergrad and then it's 3 years of graduate school.
What are some possible career paths someone could take after starting in this profession?
Well, the fun part about physical therapy is there's lots of different avenues. You can work in a hospital, you can work in a nursing home, you can work with kids, you could be a pool therapist, you could work just with athletes, you can work with vestibular patients, which are dizzy patients. So there's a lot of different avenues to work with once you get your physical therapy degree. It's a pretty wide range.
Yeah. Do you work independently, as part of a team, or both?
I would say it's kind of both. I'm working one on one with patients, so that's individual, but I do work with other therapists. We collaborate. We have 2 clinics, and so we meet. We see each other a lot. So there is some collaborative effort, but it really is mostly one on one with my patients.
What are the biggest challenges you face in your work?
Insurance. Insurance dictates a lot of how often we can see somebody, how long we can see somebody, what they will cover, and how much they will pay for their services. So, insurance is a pretty big obstacle. I also work in a private practice, so we're not affiliated with a hospital. So, another barrier is the physicians at big clinics like Essentia or Aspirus. They have incentives to keep their patients being seen within their system. So it is harder for them to refer physical therapy to a private practice.
What do you enjoy most about your job?
I enjoy really helping people in a real meaningful and tangible way. You know, helping somebody that has back pain not have back pain, somebody that has struggled for years, months to years with pain, and to be able to help them be able to manage that and improve and get back to what they love to do. It's very rewarding and fun to do.
How much flexibility do you have in your job?
Because I work in a private practice, I do have some flexibility. When I need to take off work early to go to kids' sporting events, I am allowed to do that. I can work on my day off sometimes to make up for that. So I do have some flexibility in my work schedule.
Do you think this field will still be relevant or in demand in 10 to 20 years?
I really think so. I think that AI can be helpful, and it actually does help me document and do paperwork, but it can't. You can go on Google and get exercises, but physical therapy is just more than that. And I do a lot of hands-on manual therapy, and that's something that AI can't do. We have an aging population that is never going to change, and I see people young and old, but in general, physical pain is always going to be an issue, and people have surgeries and need help recovering from that. So I don't see that going away anytime soon.
What inspired you to choose this career?
Oh, that's a good question. A couple things. My aunt is a physical therapist. She worked with pediatrics her whole career, and so when I was young, I thought that was really fun to go to her work. They had balls and games and toys and swings and things that I didn't have at home, so I had a positive experience in the beginning with that. I also, when I was 16, my dad tore his Achilles while we were in the Boundary Waters, And we went to the hospital after we got out of the Boundary Waters, and the doctors just thought he had sprained his ankle. But we went to a family friend of ours that's a physical therapist, and she looked at his leg and said, "No, you tore your Achilles." And so he ended up going to see a specialist the next day and having surgery after that. And so I thought that was pretty cool that the physical therapist could diagnose something like that when the doctors didn't. And really it was because she touched him and looked at his ankle, and that hands-on approach is what I really enjoy.
If you could go back, would you do anything differently in your career?
I don't think so. I started out working in a small, or not small, but a hospital setting, but outpatient, and I enjoyed that. I did a little bit of everything, and then the last 13 years I've been outpatient orthopedics. I've got to specialize in osteopathic manual therapy, which is what I really enjoy doing, and I don't think I would change it at all.
What advice would you give someone my age who's interested in your field?
I would say that if you really like anatomy and science and how the body works, if you like to work like one-on-one with people, it's a great career. It is a lot of schooling, so I would try to get as much college credit early on so you're not having to go so far in debt with school.
What's the most surprising thing about your job that people might not know?
I think people would be surprised at how many things physical therapists can help with. I help people with jaw pain. I think a lot of people wouldn't think about that. Headaches, dizziness, like I said. So not just back pain, shoulder pain, neck pain, not just after a surgery, but really we treat a whole heck of a lot of different things. I've helped people after car accidents, after someone's had a stroke. So there's a lot of different things that we can do, and people are usually surprised about that.
All right, thank you.